هيثم. هذه المحاضرة الثانية في موضوع viral infection of the skin. بهاي المحاضرة راح نناقش عدة مواضيع. أول موضوع اللي راح نتطرق له هو الهربس سيمبلكس. والهربس سيمبلكس is a viral infection. It is caused by herpes simplex virus. This is the picture of herpes simplex virus. It looks like a fried egg, يعني تقريبا يشبه البيض العيون. Herpes simplex virus is a DNA human alpha herpes virus. And we have two types. We have type 1 of the herpes simplex virus 1, and we have type 2 of herpes simplex virus 2. These viruses characterized by having two phases. They have a lytic phase and latent infection. The one responsible for changing an infection from lytic to a latent and vice versa is controlled by cell-mediated immunity. After the person exposed to the infection for the first time, he will develop primary first infection. And this is the infection which is occurred for the first time. Patients have no previous immunity against the herpes simplex virus. Usually, this condition are characterized by having a severe manifestation. So it is more severe than the other type of infection. It lasts longer, associated with the systemic manifestation. The second type of infection, the patient may develop a non-primary first infection. Although the person will be exposed to the virus for the first time, he will get the acquired infection for the first time, but the person have some immunity, and this cross immunity he gets it from other persons, for example, from his mother. So the clinical manifestation usually milder than the primary first infection when the patient have no previous immunity against the virus. Lastly, the patient may develop asymptomatic infection. And what we mean by asymptomatic, the patient will have no clinical manifestation, but he only develop a seroconversion, so become a herpes positive toward herpes simplex virus infection. After that, the patient will the condition subside, and the patient move to a stage of a latent phase. And from this latent phase, the patient, from time to time, if his cell-mediated immunity decreases, it will shift from a lytic to an active phase or a lytic phase. Later, patient may suffer from a recurrent symptomatic infection, and usually this is the manifestation of recurrent symptomatic infection. It is less severe than primary. It has a shorter duration, absence of clinical or physical distress, but remember, he is contagious during this period. The patient may continue to be asymptomatic viral shedder. In this condition, the patient have no clinical manifestation, but still you are able to find the virus at the area. Usually this condition subsides after 2 years of primary infection. Once the virus comes to skin, it will attach to the skin, and from attachment of the skin, it starts to try to penetrate into keratinocytes Once it enters the cell, he starts to encode his DNA, and his DNA becomes inoculated or integrated with the DNA of living cell. The cell obey the virus and start to produce the component of the virus. So it starts the stage of virus synthesis, and then after the end, the finish of the virus synthesis of this component, it starts to assembly this virus. And once these viruses are complete, it will cause disruption of the cells, cause cell lysis, and release to infect another cell. These are the stages which is passed during infections by herpes simplex virus. Regarding the epidemiology of herpes simplex, it is a disease occurs worldwide. 80% of the population have a seropositive against herpes simplex virus. Transmission, the only way of transmission of the virus from one to another usually occur by direct skin contact. In herpes simplex virus 2, it may be transmitted by a sexual transmission, or the patient will have infection from his mother, that is from the mother to the baby at the perinatal period, and lastly by the family. Well, the communicability of the disease starts from prodromal symptoms till occurring of the lesion. Or the transmission or the communication may occur at the from a person with asymptomatic viral fever, but usually the communicability of the disease decreases after 2 years from the primary infection. Herpes simplex virus can occur at any age, but usually it starts from the age of 2 to 5 years. Infections have no gender predilection, so it's affecting male and female at the same rate. The disease has no seasonality, so we can see the patient all the year round. So it has no temporal pattern. Well, once the patient once the virus, herpes simplex virus 1 or 2 inoculated in the skin, the patient will establish the primary infection at the site of inoculation. After the clinical picture will subside, the virus will have retrograde axonal transport. So the virus by retrograde enter to the sensory nerve terminal at the peripheral site. For example, herpes simplex 1 usually go, if it affecting the face, go to a trigeminal, while herpes simplex virus 2 usually go to a central ganglia. And once reach this area, it establish a latency period. This established latency, if the cell-mediated immunity decrease, or a patient is exposed to certain triggering factors, this trigger factor will result in recurrence. By what? By antegrade axonal transfer of the virus from the ganglia to the skin again. But once it reaches the epidermis at the site of previous inoculation, it will lead to reactivation of the virus. Many factors may trigger the herpes simplex infection, like fever, stress and fatigue, weakened immunity, injury, menstruation, and sunlight. All these factors may lead to reactivation of herpes and changes from a latent to a lytic phase, manifested as a recurrence. Well, regarding the clinical picture of herpes simplex virus infection, we found the first episode of primary herpes. The patient will have a multiple severe lesion. This lesion lasts longer, and typical lesion, each lesion will progress in the following. So it starts as a papule, then become a vesicles, then pustule, ulcer, crust, and healing. Often this lesion associated with systemic symptoms like fever, headache, malaise, myalgia, illness, and it lasts 2 to 3 weeks. In recurrent herpes simplex, usually the patient will, before developing the lesion usually preceded by a localized feeling of tingling or irritation at the area. And usually it begins after that in 12 to 24 hours. The lesion, the clinical manifestation presented as a multiple grooved vesicles on the erythematous base. Usually lasts 4 to 6 days. Symptoms tend to be less severe than the primary, and usually the patient have no systemic manifestation. So the difference from the primary is that the lesion preceded by tingling sensation. Second, the number of lesions are very few, grooved vesicles on erythematous base. It lasts something like 6 days, and absence of a clinical manifestation or a clinical systemic manifestation. Well, in this slide, it shows the stages of rash evolution in herpes simplex. From the latent phase, in day 0, the patient will start to complain from prodromal stage, in which he feels a tingling sensation. In 1 day, the area becomes inflamed. In day 2 to 4, he will develop eruption or vesicles and ulcer. In day 5 to 8, these lesions become crusted, and from day 9 to as long as 14 days, the patient back to healed and come back to a latent stage. Well, regarding the perinatal infection of herpes simplex, usually this occurs in 1 in every 3,000 delivery. How the virus are transmitted, usually route of the transmission prenatally or transplacentally, it is very rare, but the common way of getting the infection is at the time of delivery or transvaginally. So once the baby passes through the vagina, he may get the virus. And in this condition, usually herpes simplex type virus 2. Or the other way of getting the infection is that in the postnatal period, and possibly from the mother, and in this condition, usually herpes simplex virus 1. Well, the clinical manifestation of neonatal herpes, it may be localized at the site of aberration, or the patient will maybe the infection involve the skin, eye, and mouth, so-called SIM lesion, or the patient may have a disseminated one, which is affecting manifested as hepatomegaly, encephalopathy, extensive necrotizing skin eruption. These are long complication of herpes simplex. He may get cutaneous complication like superadded or secondary bacterial infection. If patient has atopy, the patient will develop extensive eruption of herpes called eczema herpeticum. The lesion close to eye may cause or ocular involvement. It may cause conjunctivitis or keratitis and even blindness due to herpetic CNS may involve, so it may cause encephalitis and meningitis. Visceral, very rare. And in a pregnancy, it may cause growth retardation or neonatal herpes. Well, regarding the investigation, we may do it in herpes simplex. Usually we don't need to use a clinical manifestation, but sometimes if other investigation is required, you may do a cytopathy by isolating the virus, cytopathology, isolating the virus as a tissue, or I may do zinc smear. Zinc smear, what I mean by zinc smear, I come to a vesicle which is intact. I scrape it from the base. I open it and scrape it to the base, and by staining it we'll find a multi-nucleated giant cell. I may do serology, the serology by detecting IgM antibody against herpes simplex virus 1 and 2. But as you see in the lecture, that once the patient becomes positive, he will continue to be positive for the rest of his life. Lastly, I may detect the virus DNA by using PCR. Well, remember in the management of herpes simplex that there is no cure till now, and there is no vaccine for this condition. So what I do for the patient, I give him some supportive therapy like good education, psychological support. I may give him analgesia and keep the area clean and dry as much as possible. I may use antiviral like acyclovir, whether use it topical, oral, intravenous, and usually this is effective in a primary or in the person would have from the type of virus shedders, but usually have a little effect on recurrence. I usually give 1 tablet for 5 days. One tablet, 200 milligrams, 5 times a day for 5 days. Or I may use, if the patient suffers from a recurrent herpes simplex, I may use suppressive dose. For example, I give 2 tablets of 400 milligrams daily for 1 year.